Hello everyone, I'm Dr. Devika Chopra. I'm a consulting obstetrician and gynecologist practicing out of my own clinic, Hope Clinic at Tarde. I have a few patients who come to me that, doctor, I have missed my periods. My periods are overdue. They've not come in 7 days, 10 days. But I took my pregnancy test and it's negative. So what should be the next step? So this can be quite troubling for a few patients because they're not sure whether they are pregnant. And we as doctors take it in a stepwise manner. So the first thing that I tell my patients is that the urinary pregnancy test sometimes gives the positive result in a later time in the person's menstrual cycle. That is, if you've just missed your periods, the urine pregnancy test may come negative. Many a times patients do not wait for the 5 to 10 minutes after taking the test and they miss the faint line that comes in the urine pregnancy test. So that faint line can indicate that there's a very early pregnancy or there's a pregnancy which is not in the normal location. That is, it is in the tubes, or as we call it, an ectopic pregnancy. The next thing that I tell my patient is to do a blood test. That is a beta HCG blood test, which tells us for sure if the patient is pregnant or no. Now, keeping all these conditions aside, if all these tests also say that the tests are negative and there is no pregnancy inside, then what could be the reasons of your missed periods? So the first thing that I tell a patient is to do a pelvic sonography. The most common cause of a missed period in a patient of reproductive age is an ovarian cyst. A patient can develop an ovarian cyst in either of the ovaries, and most commonly it is because of anovulation. That is, that you have not ovulated in your previous cycle. And that can be the first most common cause. The second is, of course, as we all know it, as PCOD or PCOS, that is polycystic ovarian syndrome or polycystic ovarian disease, which also we have to actually consult with the patient and ask them a few signs and symptoms, whether they've gained weight, whether they're having acne on their face, whether they have hair growth. And these symptoms are also accompanied by delayed or irregular menstrual periods. And that would require a little bit of a longer consultation. Another diagnosis where the patient is not pregnant but she misses her periods is a high level of prolactin hormone. Prolactin is usually released by lactating women when they are breastfeeding their babies, but it can also be released in certain patients who have high stressful situations around, or they have a pituitary tumor, which is a microadenoma, which is secreting a high amount of prolactin hormone. So in such situations, the patient can usually miss her periods and they get really worried. These situations are really treatable and we offer a few medications to the patient and their periods resume to be normal. There are many other rare factors in which we divide the patient having secondary amenorrhea, and that needs to be actually more examined. We need to examine the patient a little more. So that will take like another hour. But these are the most common reasons why a patient misses her periods but a pregnancy test is negative.